So who's going to be your caregiver or care manager? Today we're talking about long-term care, and we're talking to people, for the most part, in your 60s or 70s. You're still a ways away from needing long-term care, and we're just asking you who's going to be your caregiver. When the need arises, who's going to take care of you? Or if somebody paid is going to take care of you, who's going to be your care manager? Who's going to be the person in your family that's going to manage those people? So we're looking at a study, and it's a study, it's written from the people up at UMass in Boston, and the academics are studying. And what they did is a focus group of caregivers, family caregivers, the people that are actually taking care of their loved one. A lot of times it's a spouse, sometimes it's the daughter or son, but these are caregivers, and they did this focus group, and it's pretty enlightening what they came up with. At least I found it that way, and we decided to do a whole video about it. I want to push it to Tom, and I want Tom to share with you, why are we doing this video? Why does this study and this focus group matter?
Yeah, I mean, one thing that this study does is it looks at the experience of the caregivers for families that have long term care insurance and families that don't. So they're really sort of looking at those side by side. And what was really telling when we looked through this study is that regardless of if you have insurance, when this happens to your family, it is a crisis, right? I mean, if you're needing care, if your loved one is needing care, it stops everything. And the main focus is that regardless if you have insurance. So insurance is not this magic bullet that fixes everything, but it does provide some benefits. So we'll get into that in a second. But at the end of the day, you need to really think through this and plan for this, because if it does happen, it changes everybody's lives that it touches. So let me bring up the show notes. You can find these at the link below our video. They're also on our website at cardinalguide.com. We have the board as always, and then we have the actual study here. So we'll get into it as we go through the board, but you can look to see sort of these main areas that they talked on, and you'll see they have different quotes from people who are in this focus group, which were really helpful. Later in the show, we actually show an example of a long-term care policy. You can find that in the show notes as well. But what we're going to do is we're going to sort of go back and forth, Hans and I, and we're going to walk through the board and really go through sort of these main focus areas that they asked about and talked about with these caregivers and what their experience was.
Okay, so before we get into the individual topics, there were 5 topics that they discussed in this focus group. And then again, the focus group was divided by half of them had long-term care insurance, half of them no long-term care insurance. And these are the 5 topics. As they looked at the financial impact of the care and the caregiving on the families, finding paid help. This is a real problem area, and it comes out in the comments, is how do you find paid help? How easy was it to find paid help? How difficult was it? Support resources. So when you're finding paid help, or you're the caregiver yourself, the family caregiver, you're providing the care, you need support, you need resources, you need to go places and interact with people and institutions to learn how to do this properly and give you help, support resources. They looked at awareness, attitudes about long-term care insurance. So they wanted to talk to both sides of this group. How familiar, what is your awareness of long-term care insurance and what it provides? And what are your attitudes about long-term care insurance and long-term care insurance companies? This is quite enlightening. And then future planning. We're just talking to both sides of the focus group. Based on this experience you've had, what are your plans for the future going to be now? So I want to jump right in. We're going to jump in to talk about the financial impact on the caregivers and on the family. What is the financial impact of this situation happening where they're needing care, one of their loved ones? Well, first of all, they brought up in a lot of the comments the cost quality trade-offs, is you kind of get what you pay for. And the higher quality care costs a lot. It's very expensive. It's going to go on for a long time. That's what both sides of the group pointed out, is this is going to keep going on for quite a while, and it's not going to stop. Talked about spending down their savings and how difficult that is, and to go through and all the worry and anxiety that's involved in that. And then they talked about personal sacrifices that they've had to make to be that caregiver. Um, so I just want Tom, give me your comments on this first one on financial impact?
Yeah, I think one of the things that really came out of the study is of the five topics that they talk about, this was the main one that had the biggest difference between the groups, right? The people with long term care insurance and the people without. And really, what was telling is the group of the families that didn't have long term care insurance, a lot of times they were having to make sacrifices for the healthy one, the caregiver, either the spouse or the children, right? They were cutting back hours, they were retiring early. They were having to, move across the country. They were taking on a lot of that burden of actually doing the caregiving because they didn't have that resources or they weren't willing to spend the resources to pay for a professional caregiver. On the flip side, the families that had the long-term care insurance had a lot of the same concerns about cost, about, how long is this going to last? But they had a policy there to help fund the care. So they weren't having to make the same personal sacrifices for them to provide that care. So again, both situations are hard, both are impactful, but having the insurance policy there to help cover the cost really preserved a lot of the healthy either spouse or children, they're working, their ability to work, or really just the savings too, the assets that they have saved up. One point I'll make on this are people who have saved well and maybe have been told, oh, you can just self-insure or you can self-fund this cost if this happens, which might be true, right? I'm not saying that it's necessarily wrong. What you see oftentimes is the unwillingness to spend that money, even though they have it. So they have the money there, they don't want to spend it, partly because they don't know how long they're going to need to spend it for, and they know there's a finite amount there that could run out at some point. So they're holding back sometimes this is the family making that decision. It's like, we won't pay for the care yet because we're just going to do it ourselves. We'll sacrifice now, we'll provide the care. Generally it's not as good of care, right? You're not trained to do it, and it's really emotional, it's hard, it's taxing, you're exhausted in doing it. And so again, this was of all the ones, and we'll get to this as we go through. This was the one area that had the biggest difference between the group that had long-term care insurance and the ones that didn't. Hans, I don't know if you have anything else to say on
No,
that
I
piece.
think I'm good. Let's move on to finding paid help.
So the next topic here that they discussed was the finding paid help. So again, this is a problem, right? Is if when you need care, typically this is your first experience of having to deal with this. You don't even know where to go. You don't know who to call, where to look at, where to get the care needed from. And again, this was pretty similar in both groups, whether you had the insurance or not, right? This is still a problem of you still need to find the care. One of the things that they pointed out that some of the people that had the insurance felt like they had less flexibility of who they got to hire, right? They needed to use a licensed home healthcare agency, maybe not someone that has more sort of a personal touch. Like one of the comments was that the agency sent a new person each week, so you couldn't really build that relationship. And so, but at the end of the day, it was hard finding the care. The insurance companies oftentimes didn't provide help with doing that. Um, One of the and so again, I think that's just one of the points there. Hans, I don't know if you have any other comments on that.
Well, I mean, we have clients, and even some people that are looking to become clients calling us all the time because they're in the situation, they're a caregiver, and they either have insurance or they don't, and they're trying to find somebody to hire to bring in to take care of. And a lot of them don't even know whether they should be looking for skilled care or intermediate or custodial care. And it's typically they need to be looking for custodial care. And there's little help. That's why they're calling us. There's not really much help and resources out there, or they certainly weren't available to these caregivers in this study. Now, many of these insurance companies have programs to do that. It's just they're not real well known. So the support resources was the third topic, and they're talking about what's your awareness? What can you tell me? What can you tell the group about resources that are available to support you, the caregiver, and to support the patient here or the person who's receiving the care? And, the people were generally unaware of the ancillary benefits in long-term care insurance, such as respite care, is the care for the caregiver. There's benefits for that. Caregiver training, care coordination, is the insurance policies generally, and support or payment for devices to modify the home, to keep the person at home. There's benefits for all these in long-term care insurance, and people were not aware of that. And then it talked about no resource, or at least no central resource for finding help, finding paid care, finding help for the caregiver. Tom?
Yeah, I mean, I think a lot of these policies have benefits that are eligible for the caregivers specifically, as well as obviously the patient needing care. And a lot of people don't know how, they don't know about it. They don't know how to access those benefits. They maybe know it's there, but again, they don't know who to call, how to access, what that benefit even means. Like respite care, I mean, you say that some people might know what that is, but a lot of people don't even really realize what that is. And so again, it's important to know what's in the policy. It's important to have someone like us that's also aware. So, if we're helping, when we're helping clients who are needing care, their families who are providing, sort of managing the care, we will point these benefits out and help them work with the insurance company to get these benefits there. But again, there's a lack of awareness and a lack of knowledge of how to access those benefits and what those benefits actually are. So I think it's, again, if you're going to buy the insurance, it's important to know what you have, how to use it, and be able to communicate that to either your spouse or your children, because they're the ones who are going to need to know how to do it if you're the one needing care. The next topic that was really discussed was the awareness and attitudes about long-term care. And so some of the comments were the policies were complex and confusing, which is true, right? If you pick up an insurance policy and you try to read it from front cover to back cover, there's going to be a lot of stuff in there that you don't understand what they're talking about. Hans and I, we read through all the policies, we can explain it to you. But for the layperson who just picks one up, it's not in the industry, it can be very confusing. And so that was one of the comments that they were making for the people that had the policies. There were comments that the customer service was lacking, right? So these insurance companies, you call them up trying to have questions or file a claim. Some companies are better than others. Granted that's definitely true, but on a whole, they just found like the customer service wasn't as helpful as they were hoping for. And oftentimes you're doing this at a moment of high stress. You're worried about your loved ones that are needing this care. You're trying to figure this out on the fly, and it's a really hard time to do this. And you're looking for help, and the insurance companies have fallen short on that historically. And then there's just a low trust of insurance companies, right? I mean, these insurance companies, there's a feeling, and again, some are better than others, but there's this feeling that they're trying to not pay the claim. I think historically there have been a lot of examples of that happening. I think as the industry, it's moving towards where it's getting probably hopefully better, but there's still going to be an issue where they're looking for ways to potentially not pay the claim. And that's, again, where you need to know how the policy works, what are the triggers of benefits, and how best to file that claim on the front end to have the highest likelihood of getting approved. And that's where I suggest all the clients that we have come to us first. We will help with that process of filing the claim, making sure that all the I's are dotted and the T's are crossed to have that chance of the claim being approved. Because at the end of the day, you're buying this policy to help pay for those benefits. And so I think it's important to know how that works. And again, I think using someone like us who's in the industry, knows how to do this, is a very good first step to do, as opposed to going straight to the insurance company.
Yeah, that's the reason I had Tom do this one, because I'm looking at this stuff. I read lots of studies. I'm reading all the time, um, uh, especially about long-term care, and a lot of them I don't use. And I thought this was another one of those. They said, "Oh, we got half the people have long-term care insurance, half the caregivers, half don't." And I'm thinking, "Oh, this is going to be real interesting." Is the half that do, they're going to say, "Oh, this long-term care insurance, it's just wonderful. I just love having it, and thank God for the insurance company, and everything's wonderful, wonderful, wonderful." And then the people that don't have it, "Boy, I wish I would have bought it. We don't have it. We're going broke." And I'm kind of pre-thinking this is something put out by the insurance industry, and it's going to be baloney. And I, you know, but then I get into this thing and I said, man, I second, third page, I said, these are real people making real comments and they don't really think much of these insurance companies. And I thought, well, this is something now I want to read it because this is more real. This is what the public thinks. And Tom and I are meeting with these insurance executives all the time. And, when I'm listening to them, I really don't necessarily want to give them feedback and kill the joy in the room. But you know, this is real stuff that the customer service is lacking. People have called and they're put on hold and then they can't talk to the claims people. They're talking to, so this is a real thing. And what we, Tom and I do, and the rest of our team here at Cardinal is we try to be your customer service. Even when we didn't sell you the policy, if somebody calls us and they're in this situation, um, we'll get on the phone with them because we can't call the insurance company about a policy we didn't sell, but we'll get on the phone with them and kind of peer through this. And we know people at these insurance companies because we represent most of them. So it's just, this is real stuff. And where we get to the end of it is low trust of insurance companies. In the end, people need to be protected for long. I have long-term care insurance. I'm with all this stuff, and because you need to have it. So what we're going to try to do, is pick the best situation and then work with the best that we can within this. But the thing I want to point out is these are real comments in this study, and I thought we need to address this on a video. So, and the last section was talking to the caregivers. What are they going to do for the future and their plans for the future? How has this experience affected their planning? And what we had is that these people worry that their coverage that they have, the ones that have insurance, is not going to be enough. Um, they're thinking that their planning is driven by the anxiety of being a burden, and it is that this is true of people in the situation or not. Most people that are in retirement or going into retirement that we talk to about this, they don't want to be a burden to their other family members. And the news flash, you're going to be a burden. I mean, you just are, and your family members are going to accept that burden. It's going to be less of a burden if you've planned well for this contingency, but you're still going to, there's going to be some level of it that's going to come. Planning talk, the planning talk, when they start talking about the planning they've done, it's mostly about their will, about their advanced directives, and it's about disciplined savings. We have a lot of people we experience. That's what I found, is they're very disciplined savers in retirement. They're afraid to spend any of their money, worried about this ultimate contingency. So, Tom?
Yeah, I mean, I think it was interesting when they were asking the caregivers about sort of future planning for themselves. A lot of them just made a comment like, "Man, now that I've seen what this looks like," and I can say that just in our practice, we see this all the time. Is like if you have lived through this, if you've experienced being a caregiver or having to watch your family member go through something like this, you're much more wanting to and willing to have that conversation about how do we set things up for ourselves to make sure we're not putting that burden on our children. If you haven't been through this, you don't really understand what this looks like. You don't know what kind of stress this brings on, what kind of burden that puts on you. And so I think take that, if you haven't been through it, count yourself as fortunate that your loved ones haven't needed this type of care. But learn from other people's experience, right? If they're the ones who are the most willing to have this conversation, the most willing to try to sign up for something and plan for this, read into that, right? If this happens, it is hard. It's hard on the family. It's hard on the loved ones. A lot of the planning we're doing is really to protect them. Yes, the policy is for you. It's to protect you for needing care. But really, why you're buying it is to protect your kids, to protect your family from the ones who are going to take that burden if you don't have the policy, because they're just not going to have a choice. So again, I think this is important. This isn't saying all insurance is perfect and it's a magic bullet, like I said earlier, that fixes all problems. This is still awful when this happens. This is terrible. It's hard on the families. It's stressful. Having the insurance, it just removes one of those stressors, specifically the financial piece of how do we actually pay for this care that we needed. I'm going to go over now to sort of the bottom of the board, and this is sort of our takeaways, our summaries that Hans and I kind of came up with. Most care starts at home. And again, we can say that just based out of what we see in practice. We have a lot of clients that are needing care. that's where care starts, and that's where most people want to receive care initially is staying at home. So you bring in home health care. Most long-term care insurance pays for both, for home health care as well as going into a facility. That can be assisted living, that could be skilled nursing. The insurance is going to pay, and typically, especially newer policies, in all of those scenarios. Um, Caregivers and care managers are exhausted. I mean, I can't tell you how often we're sitting across the table from a family and you can just see it on them, right? They are just worn out. And they're trying to hold it together because they don't have a choice, but it is hard work to have to do this. If you've watched our channel, you know a little bit of my personal situation where I have an autoimmune disease. I was in a wheelchair for about a month. I don't need to get into all the details here, but watching my wife have to take care of me as well as our 8-month-old child at the time, she was exhausted. I mean, it was harder on her at some level than it was for me. And I couldn't walk, right? I mean, let's just put that in some context. I mean, she was having to manage everything, right? She was having to keep the household together, do the grocery shopping, do the cooking, taking care of the kids, taking care of me, getting me to doctor's appointments. It is a lot of work. And that's not just me. I've seen it with clients, and it's just hard. Going through this is hard, whether you have the insurance or not. What's nice about the insurance is maybe you can offload the actual caregiving to someone who's trained to do it versus you trying to take that on yourself. The next one, planners are better off. So planners being, if you've sat here and you have thought through this and you have a plan in place of how to need care, that situation is a better situation than people who sort of buried their head in the sand, thought it wasn't going to happen to them, didn't do any planning, and now you really are in sort of a crisis. You're in like, drop everything we got to figure this out right now. So again, thinking through this, planning for this leads to better outcomes. And the last one is families didn't see this coming, which is typical, right? You never want to think this is going to be you. I didn't think it was going to be me when I needed care. You never assume you're going to be sick. I'm just going to be healthy for the rest of my life. The problem with that is you're healthy until you're not, right? Something is going to happen. You never saw it coming. No one plans on this happening. And when that happens, it's too late to do sort of planning at that point. Now we're in crisis management if there isn't a plan in place already. So the planning, go into it assuming this might happen to me. Let's have a plan in place if it does, and sort of have contingencies all set up. Those are sort of the big takeaways we had, Hans. I don't know if you have any comments on that.
Well, I just circle this word exhausted. That's my experience, is that when your wife came in to see me, um, I mean, not only did she all do all that stuff in the house and taking you to the doctor, she had to come in and see me about your job. I mean, you talk about exhausting. I think about us when my mother was going through her 10 years of care and all that, 4 of us living siblings. Um, we were exhausted. I mean, it doesn't matter whether you're rich or poor, covered on insurance or not. That sticks out. The other piece that I'm going to put on the financial impact is many people that have a lot of money, a lot of resources, they reject long-term care and they say, I'll just pay for it if it happens to me. But what I want to be clear is I want to connect the financial impact to the exhausted. Is you should sit down sometime with an 85-year-old dude or an 85-year-old lady who is rich. They got a lot of money, and sit down with their daughter who maybe doesn't know much about finances. Maybe she doesn't know a lot about taxes, and she's brought me in, and she is needing to talk her dad or her mom into spending their own money for caregivers. And they threw the last ones out of the house because they didn't want them there. And it just, this is not about whether you have the money or not. Is if this crisis happens to you, and it's not even about whether you have long-term care insurance or not, it's going to be a problem that you need to plan for the sake of your family. Is if you got a plan in place. So if you're relying on your own money, let's get a plan in place so that your daughter will know what to do, and she can at least show it to you that says, okay, this is what you wrote 15 years ago, that if this situation happens, this is how you're going to spend your money. So I want to go over the 7 boxes and just talk about in comprehensive financial planning. I mean, most of today we've been talking about long-term care, and the Social Security comes in because That's the first check that's paying the bills. I mean, that comes in no matter what. I didn't hear one person in this study of caregivers mention one thing about Medicare. And so Medicare does not pay for the kind of care that we're talking about here in this study. 401k and IRA, I mean, that's where people are generally robbing to pay for care because that's the easiest place to go get money. And that brings forth a bunch of taxes. So when people get in the situation, they go to that for the money, and now they got a big tax bill coming. I mean, I don't know whether we've talked about income, but there's an explosion in the need for the amount of income. And estate planning is, this is kind of part of your estate, is the time before you pass away. And this just waters down an estate and it creates a whole bunch of problems for the actual estate. So I'd like to bring Tom back on. I'm Hans Scheil,
And I'm Tom Griffith.
and we thank you very much for listening.
Thank you.